Gail McGovern, in her more than decade-long tenure as president and CEO of the American Red Cross, has led the response to multiple high-profile disasters across the country and around the world, including Superstorm Sandy in 2012, Hurricanes Harvey, Irma, and Maria in 2017, as well as a multitude of tornadoes, hurricanes, floods, wildfires, home fires, and other local disasters that affect our country each year. And then 2020 struck, throwing in a global pandemic and fear of national blood shortages. So with that as the backdrop, no pressure, Gail, a warm welcome to Gail McGovern.
Thank you so much, Jill, for that kind introduction, and thanks for everything that you do to support our mission. I'm just so grateful for your leadership on our regional board and also on the Tiffany Circle. And I want to start by giving everyone a sincere thank you for attending today's virtual event. This is an amazing group, and you represent some of our most generous and committed Red Crossers. And I know a lot of you are based in New York, which was very hard hit by COVID-19. And my heart goes out to all of you and to everyone in this meeting who's been personally touched by the virus. And I'm sure you're all extremely busy and preoccupied during this challenging time. So I'm especially grateful that you joined the meeting today. I should start by saying that despite the back-to-back crises that we've experienced, COVID, unemployment, the tragic murder of George Floyd, I can't imagine anywhere that I would rather be than the American Red Cross. And despite the fact that we've been working around the clock, first adjusting to the new normal of the pandemic, and now with all the protests we've seen across the country, I have to say that my leadership team is continuing to amaze me. They've been persevering to help our country in ways that make me very proud and grateful. And Red Crossers do what it takes to fulfill our mission. And this time of crisis is proving over and over again that that's the case. So many of you in this meeting are dedicated volunteers and donors and leaders, and you're helping to make our work possible. So let me start with our response to the senseless killing of George Floyd and the nation's reaction to this horrendous act and so many similar events. So many of our Red Crossers and the people in the communities that we serve are feeling very real pain, fear, and anxiety right now. And the Red Cross strongly rejects hate, racism, violence, bigotry of any kind whatsoever. And we stand in solidarity with anyone who's faced the pain and terror caused by racism. I've communicated this message often to our Red Cross employees and volunteers over the last few weeks through several messages and lots of videos. And I've reached out to our African American resource group and to our top 100 Black leaders. And I can't even describe the outpouring of responses that I got from our staff and from our volunteers. They cover the spectrum of grief, sadness, fear. I've heard stories of how mothers instruct their Black teenage sons how to behave when they're being pulled over by the police. I've heard stories about a Black spouse who served in the local police force, which of course is a double challenge being Black and in law enforcement. I've heard stories of racism and discrimination and isolation. And frankly, answering those hundreds and hundreds of notes, it really knocked the stuffing out of me. But most of all, they ended in gratitude and pride to be part of an organization that cares. And the American Red Cross has 7 fundamental principles. In fact, all Red Cross and Red Crescent societies around the globe have to adhere to these principles. And one of those principles is neutrality. But neutrality does not mean silence. Two of our other principles are unity and humanity, and those principles compel us to speak out against violence and against hatred and against racism. And we need to make sure that this just doesn't become another killing that we mourn and then go back to business as usual. I may be naive, but I'm hoping that this is a moment in our history that can really change behavior. And my leadership team and I are determined to continue the dialogue and to effect change at the Red Cross where it's needed. And from a mission perspective, our folks in humanitarian services have been very involved in the George Floyd passing. There've been several marches and vigils in Minneapolis, and we opened respite centers there. We also supported vigils in North Carolina, where Mr. Floyd was born. We are actively engaged in Houston, where we had 75 volunteers and staff who distributed 2,000 bottles of water and 1,500 snacks in the neighborhood where Mr. Floyd grew up. We operated water stations at the public viewing, which took place in Houston, and that lasted 6 hours. The governor was there, the mayor of Houston was there. We provided snacks, water, and masks for about 2,000 people at a candlelight vigil at the high school that Mr. Floyd attended. And one of our employees who has 35 years of service with the American Red Cross has been very active in the Black faith community, and she was asked to attend the private funeral to represent the American Red Cross. We've also been engaged with our partner organizations in the Black and Brown communities to identify unmet needs and to help respond to them where we can. On a much more uplifting note, somehow in the midst of a pandemic and civil unrest, we've been fulfilling our mission every single day. From a disaster response standpoint, we've had to make significant adjustments to safety protocols to be able to provide services in a COVID-19 environment. And this includes providing comfort and mental health counseling virtually with limited physical contact. We've also developed feeding protocols so that if we open up a shelter, it's not cafeteria style, but separate box meals. We're also using hotels to shelter displaced people instead of large congregate shelters wherever possible. And we've had situations where if we can't shelter this way, we'll take every precaution to make sure our congregate shelters allows for social distancing, for proper sanitizing, and other health and safety protocols. So it's fundamentally just changed the way that we are delivering our mission. And we certainly have been busy with tornadoes and floods and storms. And believe it or not, since February, when COVID reared its ugly head, we have responded to over 17,000 home fires. And for families that were impacted by a home fire and they don't readily have access to the internet, we've been bringing a spare iPhone, and we place the iPhone about 6 feet away, and then we FaceTime with them so that we can make sure they get all the resources that they need to recover, whether it's for PPE or for a place to stay or financial assistance. We've been there. And we also are continuing to see an incredible impact from our home fire campaign. And this is a campaign where we have been installing free smoke alarms in vulnerable households. And we go into the household, we make sure they know how to get out in the event of a fire, and smoke alarms cut the mortality rate in half. And we have already installed over 2 million smoke alarms. Now, of course, we've had to stop these installations because of COVID, but nevertheless, in the month of May, an additional 20 lives were saved because of this campaign, and that brings the total to 760 lives saved. And I'm so proud of that campaign and what we've been able to do. I'm sure all of you know that the hurricane season officially was kicked off on June 1st. And all of the forecasters are telling us that this is going to be a real doozy. And we have been very fortunate so far. We've already had 3 named storms, believe it or not, which is very unusual so early in the season. And fortunately, we dodged a bullet on all 3. Cristobal, which was the one that really looked like it could seriously impact several states, did not, but it was still a really good drill for us. We worked with several state and emergency managers in Cristobal's path, and it gave us an opportunity to review all of our sheltering plans in a COVID environment. We assigned 400 volunteers to Cristobal. 150 of them were going to be virtual. The rest got deployed all around the country in the states where this particular hurricane was supposed to hit. So we had volunteers in Texas, Louisiana, Mississippi, Alabama, and also in Florida. And we had supplies pre-positioned for about 6,400 people that would be in Texas and Louisiana, and it included all sorts of COVID supplies like masks and sanitizers and thermometers, etc. Other parts of our mission, I have to say that when it comes to our blood services, I just can't say enough positive words about the miracle that our biomedical colleagues have been pulling off. Their ingenuity, their speed, their fast reactions to some real significant changes in the demand for blood just over the last few months has been remarkable. They put in all kinds of safety protocols in place, and they're very costly and time consuming, and it adds a lot of complexity to our donor centers. But when the pandemic started, we were facing a big blood shortage. And that's because a lot of elected officials were going out and they were telling people stay home except for groceries and pharmaceuticals. And when we spoke to a number of governors, they said, okay, we'll tell people that blood is essential and you can go out to donate blood. And just when we started getting our inventory back again, the hospitals just all but shut down all surgeries so they could deal with COVID patients. And then we were looking at a blood surplus. And now, as hospitals are starting surgeries again, we're once again scrambling to meet demand. So this has been a roller coaster ride, and somehow we have managed to provide hospitals with the needed blood supply that they need despite all of these rapid changes. And through all of these challenges, we were able to collect enough blood to save lives. And we've done this while we've taken every precaution to keep our donors safe. And we're social distancing at the drives. We're wiping down the beds at the drives. We are taking every single possible measure. We give our donors masks. We give our staff masks. And we're doing everything we can to keep our employees, our volunteers, and our blood donors safe and healthy. And I really couldn't be more proud of the skill that we had to show to be able to make all of these adjustments. And it was really quite an extraordinary time, and it isn't over yet. You probably have heard or read a bit about convalescent plasma. This is when you collect plasma from someone who has recovered from COVID-19 and you transfuse it into a patient who has the disease with the thought that they had antibodies that could then help the existing patient. And in the initial phases of the pandemic, the FDA asked the American Red Cross to serve as the lead in standing this up across all 65 blood bankers in our country. And as you can imagine, this was a massive undertaking, and we moved at the speed of light to put up a website, to get each of the criteria on the phone, setting up appointments, etc. And the agility that we showed in getting this done was really pretty extraordinary. Interestingly, convalescent plasma is still categorized as an investigational new drug, and the results of its efficacy haven't been completely proven, but it looks very positive. We're waiting for a study to come out from the Mayo Clinic to give results on the efficacy of convalescent plasma, but we've already, just the American Red Cross, have sent more than 9,000 units to hospitals, and they have been transfusing these units to patients that are really quite ill. And we've also been stockpiling quite an inventory, over 5,500 units, in case there's a second wave or another outbreak. And this is really important because I am very optimistic that we're going to find out that this is making a difference. And plasma happens to be the only component of the blood that we collect for that you can actually freeze. So it has a long shelf life. So we want to be ready in the event of another outbreak. Another really exciting piece of news that hit the press as well from our biomedical services organization is that on Monday, June 15th, we began doing antibody testing on every single blood donor that walks in and donates blood. And we'll continue to do this for the next 4 months. It's very costly for us. It adds about $3 million of expense per month, but it's going to help give information to our donors, and it's also going to help attract donors. And during this time, we also plan to share the data with the FDA and with the CDC, because it's going to help from an epidemiology perspective and a tracing perspective. Other parts of our mission, we continue to help our international colleagues around the globe with training, preparedness, financial during the COVID epidemic. As always, we are serving our military members and veterans and their families with emergency connections by phone. We have large calling centers where we do this work, but because of COVID, all of our employees are now taking those calls from home. We also normally provide face-to-face workshops for military members. A good example of that is the Reconnection Workshop, where we help military members that are returning home from deployment reacclimate with their families. So we quickly move the entire workshop to a virtual workshop, and it includes modules like diffusing anger or reconnecting with your kids, and there's a special caregiver module. So we're fulfilling our mission despite COVID. And our training services organization, their course offerings have dropped significantly, which is no surprise because of the face-to-face need for training. But the good news is our training services team quickly stood up 2 virtual courses. One is psychological first aid, because so many people are feeling isolated at this point in time, and also social distancing in the workforce. Right now, both of those courses are free for the general public until June 30th. They've been very popular, and we plan on charging $20 for each of those courses. So before I answer your questions and Jill and I chat, I wanted to close by once again sharing a very big thank you to all of you. I'm amazed by your ongoing generosity and your commitment and support of the American Red Cross.